how to kind of regulate the Dr. Parjeet Kaur has also joined us. She's Associate Director Diabetes, Medanta Hospital. Dr. Kaur, pleasure. Dr. Kaur, we are discussing a report by Lancet Global and also which has been published in South First about how South India has the largest diabetic patients. Kerala topping the list, followed by Puducherry. I'm a South Indian. This show is called The South Indian. I always prided myself thinking I eat very healthy as compared to, and no offense to the white makhan, te parathe. I don't eat all that. I lived in Delhi, so I'm a Punjabi virtually, but then I never ate that because genetically I cannot digest it. I'm lactose intolerant. Dr. Kaur, why is the South looking so bad so far as diabetes is concerned?
Right. So I was listening to the conversation going on earlier. So one thing is very clear, which is not only restricted to South, is the urbanization, which is making the ready-to-eat food, the processed food, more easily accessible, of course, coupled with the sedentary lifestyle. But one finding which is also correlating with the higher rates of diabetes in Kerala and South India is the higher rate of abdominal obesity. So what is abdominal obesity is that we have more fat on our belly, so which ultimately translates into having a more fat on our organs, like more important organs are the liver and pancreas. So when we get more fat there is a higher chance of getting diabetes. And it was shown in that study also that almost 65% of women in Kerala had abdominal obesity. So that is one thing very alarming, that abdominal obesity, even at the lower BMI, put the person to a very high risk of developing diabetes. That's number one. And number two, of course, could be also, which is also again not, I would say, specially restricted to South India, but the lack of awareness that people are not getting themselves tested even for the pre-diabetes. Because one person has to know the risk. If the person has a higher abdominal obesity, higher waist circumference, more than 90 centimeter in men and more than 80 centimeter in women, they should know their risk and they should get self tested. So if even
Or
if we
just
can
a minute,
catch them
Dr.
at
Kaur.
pre-diabetes.
Dr. Kaur, I have
Yeah.
been reading about abdominal obesity, but a lot of women say, for instance, that I gave birth to 3 kids and all of them C-section. So I do have abdominal obesity compared to you, the man who's never given birth even to a worm. Do you think that stands as an argument, doctor?
So one thing is very true, that it's not the birth. I think it's the physical, maybe the inactivity and that kind of, once a woman is giving the birth and involved in the home chores, that the woman is not able to give time to herself to take care of her own health. But yes, women are also more prone to get abdominal obesity. That's very right. But if we have to tackle that, then again, ultimately the lifestyle comes into the picture. In
Basically,
the
it's
sense
about
we are
what
talking
you and
about.
Dr. Jayaprakash are saying. It's all in our hands. We have moved. The needle has moved. Dr. Jayaprakash, what is the way out, sir? If I eat roti, if I eat chapatis, then there is a gluten thing. I get bloated. So recently a new phenomenon is that, there is, you've got allergy towards gluten. I drink milk. I'm lactose intolerant because I feel bloated. Anyway, I am lactose intolerant. If I eat rice, they say, are you eating polished rice? You take out all the starch and then you eat the rice. How much of quantity you're eating the rice? What is more important is what are you eating along with the rice? If you're eating rasam, it's fine. But if you're eating butter chicken, it's a problem. Dr. Jayaprakash, I think all of us have to go to medical school to really understand what one should eat and what one can't. Is there any which way by which old grandmothers used to say, keep your stomach, when you get up from the table, you should feel hungry. That is the best way. Do not eat as if you will fall. What is the way out, doctor?
No, I think all these talks about polished rice and brown rice, red rice. It's actually the quantity of carbohydrate and other nutrients. The simplest way is to follow the plate system, where you have a plate, a small plate. 1/4 of that should be your carbohydrate, whatever rice or wheat or whatever carbohydrate that you are comfortable. The more unpolished it is, the better. It has more fiber. Then the other 1/4 should be only the fat, and rest should be your veggies and the protein. So it's about the quantity and the color of the plate. For the veggies also, vegetables also, the more kind of spread out in terms of the color gives more of nutrients. That's the simplest way to go about it. I don't think there is much to. It's all of a more of a marketing gimmick in terms of, say, low fat, low carb rice and low sugar, low sodium salt, and all these things.
Right.
Ultimately, it boils down to the quantity and also the amount of exercise. Every individual, in terms of the calorie requirement, may differ. We are mostly sitting here in sedentary, and our requirement is vastly
Yeah.
smaller than somebody who's working in the field.
Right,
So
right.
it should be individualized, and
Yeah.
it should be the quantity which matters rather than
All
just names.
Of course, our Prime Minister has also made a special mention of it. Listen into what he has said, and I get back to Dr. Parjeet Kaur then.
आप सभी फिटनेस का महत्व समझते हैं, इसलिए मैं आज एक ऐसी चुनौती की बात भी करना चाहता हूं जो बहुत जरूरी है। आंकड़े कहते हैं कि हमारे देश में ओबेसिटी की, मोटापे की समस्या तेजी से बढ़ रही है। देश का हर एज ग्रुप और युवा भी इससे बुरी तरह से प्रभावित हो रहे हैं। और ये चिंता की बात इसलिए भी है क्योंकि ओबेसिटी, मोटापे की वजह से डायबिटीज, हार्ट डिजीज जैसी बीमारियों का रिस्क बढ़ रहा है। मुझे संतोष है कि आज देश फिट इंडिया मूवमेंट के माध्यम से फिटनेस और हेल्दी लाइफस्टाइल के लिए जागरूक हो रहा है।
Dr. Parjeet Kaur, let me ask you the last question before I let both of you go. Our country is known to kind of eat sweets on any good occasion. Muh meetha kijiye, have some meetha. You know, what should we know? I mean, what should we be doing now? Is it that we just eat sweets when there is a good occasion? Apart from that, we don't touch it. What is it in the atmosphere that most of us, particularly in the South, have become so prone to diabetes? I mean, what is it that we need to cut back on?
Right. So I think it's important to understand it both at community and at individual level that what kind of health you have. So if a person is already at risk of having diabetes, so we need to go have a balanced approach in that. As far as the having sweets are concerned, everything needs to be balanced out. Definitely we cannot say, okay, exclude sweet, don't touch sweet. That's not possible. Similar the way we're talking that do not eat carbs, that's not the way out. The way out is, I think, having a balanced diet where we are having a more of vegetables and pulses and protein and less of carbs, keeping a track on our health by regular checkups, checking and picking up the pre-diabetes at earlier stages, and then going accordingly. So having an occasional sweet when a person is already healthy, doing well in all the metabolic health parameters, and preferably the home sweet would be a better option where we know how much oil we have put in, how much sugar we have put in. That is something we can do, but definitely we just cannot go randomly and celebrating all the occasions with sweets all the time. So it has to be a balanced approach.
Who has the time to make sweets? You are working and so am I. So I think the options are also very limited now. But on that note, thank you very much, both of you, Dr. Jayaprakash and Dr. Kaur, for joining us on this broadcast.